Greetings again, Fischer Clinic family. This is our second edition of the Fischer Clinic Fireside Chats, and as you can see, things are a little bit different than last week. In keeping with the recommendations of the local, state, and federal people making decisions, we have decided to try to isolate ourselves as much as possible. So Dr. Fischer and I are staying away from each other right now, and then also our nurses are working from home, and so again we're just trying to comply with what's been recommended to us to try to break up the cycle of this virus, so life can get back to normal as quick as possible. There's a lot of news and anxiety and uncertainty in the world today, and if you dwell on that, it can become overwhelming and again anxiety provoking. And so I just want to begin with, remind everybody that life is always uncertain, even in the best of times. We're not promised health or life tomorrow. We're just promised this moment. And so I just want to remind everybody to maybe to take the most of this opportunity, because even in the best of times, tomorrow disability may come, death may come to us or a loved one at a time that we weren't expecting. And so use this time of change and uncertainty to maybe really refocus your life and your expectations and your perspectives and your priorities, and really think about how precious and valuable life is, how precious and valuable your relationships are. Live in such a way that as if you're struck down by coronavirus today, or if you're hit by a bus in 6 months, if you had a heart attack in 5 years, or you die of cancer in 10 years, or you die in your sleep in 30 years, that it can be said of you that you were generous in your giving of yourself and all that you are, that you loved lavishly, that you blessed others, even those who necessarily didn't deserve it, that you forgave often and asked for forgiveness often, and maybe let these things be your priority, even in this uncertain times, because again, life is always uncertain. We did want to touch on a couple of things that we kind of touched on before, and also some new things. We are continuing to try to take care of most of our business by phone. Our business is you, so I don't mean to make little of that, but again, in accordance with the recommendations that have been given to us by authorities, we're trying to minimize the spread of this disease, and our concern is because of asymptomatic carriers that there may be, one of you may bring it to us and then we may give it to someone else, especially a high-risk patient, or we may have it from somewhere else and give it to any one of you, and so we're trying to avoid that. We're only trying to see people who absolutely need to be seen face-to-face. And rest assured, if we talk to you and we think that we need to see you face-to-face, we will. But in the meantime, our nurses are working from home. By the blessings of current technology, we have that full capability. So when you call the regular numbers, you will get the proper nurse, and they'll relay information to us. For my patients, call 919-258-2840. Dr. Fisher's patients will continue to call his number. If you get the wrong number, Kelly will get us to get you to the right places. Still at nighttime, if you call the office number, you'll get us. If you text, you'll get us. If you email, we may be later on that of checking it, just depending on what time of day. So if it's urgent, call or text. We also wanted to speak on the current state of testing and the current availability of testing. Testing continues to be difficult to come by, although it's somewhat more available than when we spoke last week. Several of the hospital systems have set up ambulatory testing sites. There are 2 that we know of in the area. Actually, one of Dr. Fisher's patients was able to be tested later this past week. However, they were told that it'd be 10 days before they would know what the results were. We continue to feel like there's not a whole lot of benefit in testing. Early on, testing was beneficial for the epidemiologist to try to locate and isolate index cases, but as the cases become more widespread, and in fact there's been community spread of the disease, testing becomes less and less important. There is no therapeutic benefit of testing, since there's really no cure or treatment at this point. And so since the the mandate is for us to all to be quarantined anyway. We feel like, if you come down with a fever and you're sick, as long as your symptoms are not very severe, the recommendation is still to just stay at home. If you go out to test and there's no compelling reason to, one, you're putting other people at risk, the medical providers that you come in contact with. If you wind up having the disease, you put them at risk. The protective equipment is limited, and so you're using that. If you don't have coronavirus and you have the flu or another cold and you go out in public and to a testing site where it may be more prevalent and you get coronavirus on top of what you got, then that's not a good idea either. And so again, we just really don't feel like there's a big push to go get testing. If you have a compelling reason, for some reason or another, give us a call and we can talk about it and see what the next steps might be. We did want to remind everybody that for most people, this coronavirus still remains a self-limiting illness, and that it will resolve with simple at-home care. Stay well hydrated, take something for your fever. There's some concern in France that maybe when you get sick, ibuprofen or Aleve are not the best, and so Tylenol might be better for a fever reducer. This doesn't mean that if you're on an anti-inflammatory now that you're more likely to get the disease. But if you do come down with a fever, it might be a better idea to take Tylenol instead of ibuprofen or Aleve or Motrin or those sorts of things. If your symptoms are more severe and you start having problems breathing, dizzy or lightheaded, or just worsening, give us a call right away. If you're really severe, you may call EMS, but if you just start to progress and you're not sure what to do, call us and we'll help direct you to what the best course of action would be. We also wanted to touch on the news of a possible treatment and prevention medicine. There's some small study done in China and one in France on an old medication that's used to treat autoimmune disorders such as rheumatoid arthritis. Just take note that those studies were both very small. They were not randomized. So that data and that information is still largely unconfirmed. The virus did seem to clear quicker in the people that took the drugs. The death rate was still about the same as the general population if you look at the studies, and so it's kind of hard to confirm or not. It is somewhat hopeful, but still uncertain. We don't recommend widespread use of these medications in the general public for treatment or prevention until further information comes out. If those medications are used, they should probably at this point be used in the hospital by critical care specialists for people who are really, really sick, since it is experimental. The medication is not without some risk, and especially depending on what other medications you might be on, there are some cardiac side effects and arrhythmias that could be pretty serious and even fatal. And so it's best right now for the general population just not to be on those medications. Ava spoke to one of the local pharmacists on Friday, and she had gotten a lot of requests for the medication and was even concerned that she may not have enough to treat her patients who are on it chronically. So even though it's been said in the news there's plenty of this medication, that's not always the whole truth. And so again, at this point, because it's experimental, it should be used probably in the hospitals. If it does turn out to be a really good thing, then we'll address that as time comes. I wanted to assure you also that we, Dr. Fischer and I, and our families are not taking this for prevention, and so we are practicing what we preach. Last time we did speak about what kind of things we should be doing during this time. Things are slowing down with life. You can't go to work. You can't get out of the house. What kind of things should you be doing? I mentioned earlier just to really cherish each moment, every moment. Cherish your time with your family, your friends. Take care of yourself. And I wanted to touch on just some self-care tidbits that we should discuss. And here at the Fischer Clinic, we like to talk about whole body care. And so, of course, in your physical, we want you to stay healthy, eat healthy. Try to get, as best you can have access to, fresh fruits and vegetables. There are some philosophies of eating the rainbow of colors of your fruits and vegetables, and that the nutrients of those foods will help build your immune system, your metabolism, all those things. So, stay as healthy as you can with what you eat. If at all possible, get some exercise and maybe the extra time that we have now will afford you an opportunity to start a new habit. Start a daily walk, start an exercise routine, a video exercise routine or something like that. And maybe this is a good time just to, like I said, get in a new habit and exercise your body and get yourself in a little bit better shape.